Hi, and welcome to Global Interpreting Services podcast. I'm Dawn Flanagan, the CEO and president, and a nationally certified sign language interpreter. And today we're going to talk about medical interpreting with Dr. John Swetech.
Hey Dawn, thanks for having me. So I'm Dr. John Swetech. I'm board certified in family medicine and osteopathic manipulative medicine. We run a clinic here in Clinton Township, Michigan, and we've been using global interpretive services for quite some time.
So how has using interpreters made a difference in your practice or in working with a patient?
So everything is about communication in medicine. We need to make sure our message is clear. We need to make sure the patient's message is clear. We need to make sure we know what their needs are, and we need them to know what we need them to do to have a successful relationship, to have good outcomes, things like that. It's definitely helped in those things to have accurate communication so that we can build trust. We can take care of the patient safely, optimize outcomes, things like that.
A lot of doctors feel like if they use an interpreter, it's going to increase the time of the appointment. How do you feel? Does it increase your appointment time?
That's a good question. I'd say on average it's about the same, which is pretty interesting. I will say some of them will be faster because generally when patients don't speak English, they want to keep it to the point, I'd say, and they keep it brief and succinct, and those can actually be very quick. But also this is a benefit. Sometimes these patients, they're neglected in society. They don't have a way to express everything they need to express. So when they come and they have a translator, they're able to unload the burden they're carrying. So we do have some that are a little bit longer. I don't think the translation itself makes it longer. It's pretty efficient. I'd say on average it ends up being about the same, which is an honest answer there.
Great. And so what you're saying is because they haven't been able to communicate effectively with either mental health professionals or other doctors, when they come to you and they use the service, they feel like they can tell you everything that's wrong and really get good, appropriate services?
Absolutely.
Are you at all concerned about patient privacy with using an interpreter or a translator?
Good question. So absolutely, privacy is huge, especially in this day and age. I trust you guys and I haven't had any problems. The translators are professional. It seems like they're following codes and all their ethical obligations. You always worry about, I wouldn't just get some random place, find something online and do some random service. Who knows? I know your team has the training and the compliance stuff to make sure that stuff stays where it needs to be and kind of go from there.
The benefit of using interpreters who are professional.
Absolutely.
Instead of a family member. So how do you feel about them using a family member or a friend or a child even or a parent of a child to communicate? How do you feel about that personally?
So that's a big one, and it's one that we should definitely unpack. So we always, and I think we're obligated, we always offer a translator. It's up to the patient whether they want to use one or use their own family member. But what I've found is when you use a family member, sometimes I know the language to some extent. They tend to sense, I've seen a few scenarios. Sometimes a family member will censor things. The person will say a certain message and they'll change it a little bit, and it's hard for the patient to know if what's actually being translated, what's being trunicated, what's being adjusted. I see that. Also, sometimes I see that when they have a family member come talking, the family member might talk for them entirely, and I don't think that's right because I'm trying to tell a person, hey, you got to do this, and they'll say, yeah, I don't know if they're actually going to tell them and stuff like that. So that's a big challenge and a struggle. You always worry if you don't know what their relationship is. You wonder if there's something going on that they're not telling you and they're just giving a different story. Fortunately, I think we get to the bottom of it, but when you have a professional translator that's trained, you can get around that stuff. You can make sure the message is clear and it's unfiltered, uncensored, things like that. Sometimes too, I wonder about sensitive topics. say, for example, a patient has something to do with mental health they don't want their family member to know about, they might leave that part out and they're struggling with it. They have no way to get treatment and management for that. There's a lot of issues, sometimes sexual health, there's barriers there. It could be anything. Culturally, you have to be sensitive, and we don't know what they are allowed to talk about, what they're not allowed to talk about. So those are the challenges, and that's all mostly remedied with having a good translating service.
Now, I know that you are pretty fluent or feel fluent in a language.
Mm-hmm.
Do you feel okay providing services one-on-one, or have you ever come across a time where you are fluent in a language, you're conversing with the person, but you just don't feel it's working? Have you ever come across that and then used a translator to help?
Yeah, I'm glad you asked that, and I actually do have a very good example. So I'm fluent in many of the Balkan languages. Every once in a while I get someone, there's different dialects where I just can't get the message across, or it doesn't seem like it's clicking, and sometimes I would still consider myself fluent, but sometimes they just go fast and I'm like, slow down, I need to process this. Or they assume since I am the level I'm at that I know every single word, and that's not always the case. So it can be tricky. I know a decent amount of Spanish and stuff, and sometimes we're able to get by, but same thing, once the conversation gets going, they'll just go rapid fire, and I gotta slow it down. Those things are where a translator helps. But I told you guys a story. So I had a Balkan patient, and he's a long-term patient. I think we give long-term care with him. He came to me on a number of times where he was requesting a handicap pass, and you need valid medical reasons. There's strict criteria, and I can speak with him pretty fluently. So he was asking for a handicap pass, and I'm like, well, what's it for? And he's like, for my wife. I'm like, your wife's not even a patient here. I can't give you a handicap pass for your wife. And this guy was so distraught about this. And he came 2-3 times. I did always offer the translator, but he declined it. And he'd say, I need a handicap pass for my wife. I'm like, I can't give you one for your wife. If she's a patient, she has the right criteria, we could help with that, but I can't just give you one. And I'm like, what about you? Do you have any issues? And the message just wasn't getting across. Finally, I'm like, you know what? You've been here 3 times. I'm just gonna, let's get a translator on. And the story unfolded. So he was embarrassed because he has to take his wife to different doctor's appointments at these hospitals, and they don't have good parking. And he does have some leg and back issues that weren't bothering him enough to seek direct medical care for, but they certainly were present and they were an issue. So he was embarrassed because he has to take her to these doctor's visits all over the place, and he can't even get out of the car and walk more than 20 feet to help her out. So the fact that we got the translator, it all opened up the story. Also, we were able to help with those issues too a little bit because now we were aware of them. And he certainly met multiple criteria, so that was an eye-opener for sure.
That's wonderful. Using an interpreter when you don't feel like everything is getting across.
Mm-hmm.
I mean, even as a sign language interpreter, sometimes, the message is a little skewed until you can kind of step back and go forward again. And using an interpreter who's used to doing those kinds of things and getting clarification, that was definitely a win-win for everybody. If you have a patient and they don't understand how to use their medication or to do their physical therapy appropriately, or just follow directions on self-care at home, what do you feel the legal ramifications are if you don't explain that clearly to them and they don't do it properly?
We do, I believe and I think everyone more or less by law needs to have some translators on service or on ready on call in case there is a patient that can't speak English fluently. There's penalties for not having that service. We do have a few deaf patients, and we've had to use sign language as well. I know there's protections for the hard of hearing deaf community, so you need that on standby as well. So having good translators on service helps avoid those penalties and complaints and things like that. Obviously, if you're not able to communicate the risks and instructions to the patient, and they have a poor outcome, there's potential for malpractice issues. There's a lot of different layers to the regulations that you could violate if you're not using a translator and making sure everyone's on the same page.
So it's not just about communication and providing, what the law says you have to for communication. There's responsibility on the part of the doctor and the medical team that they have to ensure that someone has, to the best of your ability and their ability, understand what they need to do to have a successful outcome. That's what I'm hearing. It could be malpractice. It could be all kinds of different things if you don't take care of that. Do you feel that it's morally and ethically appropriate to provide an interpreter rather than, we heard the instance about you, trying to get that message across with that fluent language that you speak, but that it just wasn't getting there, and you finally said, look, this isn't your choice, this is my choice. I want an interpreter so I can make sure it's happening. Do you feel that there's moral and ethical obligations about providing interpreting services? Let's say one of your staff members was fluent in Spanish, but you weren't positive that they were fluent in the medical lingo, right? Mm-hmm. You said that was your tricky part, was medical lingo. Do you feel like there's ethical and moral obligations with that to provide a professional person instead of an office person, or are you just trying to work through it?
Medical lingo is certainly, we can agree, different than everyday lingo. I'd also say this too. We mentioned cultures a little bit, but cultures are different. The way people express things are different. I'm trying to think of a good example, but let's say I had a Spanish-speaking patient. The way they describe their symptoms and this isn't across the board, but I've seen this a few times, it's more emotional symptoms and things like that for headache or belly pain. So it was helpful to have a translator to be able to comprehend that and make sense of
navigate those cultural bumps.
Yeah. So that's an added bonus. We're thinking just the language, but it definitely helps with cultural differences as well. The ethics that I kind of look at and they taught us in school, number one is autonomy. You gotta make sure that the patient has say in their care and they're the ultimate decider of it. I tend to really push that one in our practice. I see some places that set that one aside, and the old medical model used to be a little bit more like you do this, but I try to make sure the patient is driving the ship. If they want me to make the decision, I can make it for them, but I'm ultimately leaving it up to them. So in order to properly give them autonomy in their situation, you need to thoroughly be able to communicate and explain things. You wouldn't be able to say, hey, do you want to do this? Do you want to do this? Do you want to do this? Hey, I see this. These are the options. You can't have that privilege for the patient if you don't have good communication, in this case through a translator. Number two is do no harm. A lot of times, how are you going to do no harm if you're not getting the full message and you're just throwing random stuff at a person? The next one is beneficence. I might be saying a little bit wrongish. I think I got it, but it's been a second since we heard them talk about it. You got to do what's best for the patient. What's best for the patient is good communication and making sure they understand what's going on. And then justice. I don't know if this one, how this one ties with this one, but I think you could say justice, like some fairness in it. They should have the privilege and right to have accurate communication.
So it's great to use interpreting services or to have them on standby if you need them. You feel that it gives the person who speaks another language or who are deaf or hard of hearing autonomy in their care. So no one is driving the ship for them. They're driving the ship themselves, which is so important. And really what we as interpreters strive for is letting people have that autonomy, and that you want to make sure that they get good, accurate, appropriate care. And by doing all of the things that we talked about, getting effective communication, letting them steer the ship, making sure they understand what they need to do in their own care for a successful outcome is so important. So those are some great reasons to provide an interpreter. Mm-hmm. Even if you feel like, I don't know, the cost. I mean, was that a concern for you? It's got to be a concern for everyone, but mm-hmm. Was the cost the first thing that struck you as, I don't want to pay for it? And you can be honest with us here, that's okay.
Let me expand on it. I think you guys have been fairly economical. It's I know that you might have different plans and stuff, but in our case, it's by the minute, and the cost is reasonable. I don't think it's anything obscene or anything. It seems like if you put the little investment in, you'll have a good relationship with the patient. They'll trust you. They'll come to you. You'll end up getting more visits, and usually they have family members or friends that also don't speak English, and they'll bring you more patients, so they'll feel comfortable. So it's a good investment all around. I think you guys have been good there and fair there. So that's the big one there. I'll throw in one more cool thing that I've noticed. I've been impressed with these guys because the speed of getting a translator on has been very fast, and they do have a lot of languages. A few times we had some, remote languages that you don't even know
exist, like the rare languages.
Yeah, I can't think of any off the top of my head, but I'm like, oh man, I'm going to be in trouble. How are we going to do this? And you listen to the options, and they've been there, so... And then I'm like, well, maybe it's going to be a while, or they might not have someone on site. They've been very reliable. I don't think we've ever had a instance where we didn't have a translator available. Also, too, sometimes after hours, I believe it's a 24-hour service. A few times after hours, we've needed to make a phone call or something, and we've been able to call a patient and get them on it. I don't have too many of those, but I believe we've done that a few times in the past. And not just for the patient visit, for when patients are being roomed or check out, things like that. They've been helpful there, and it's been great for our patients. They love the trust. They've opened up to us, and we've improved many lives together. So that's the big one.
Wonderful. Thank you. And why don't you tell us a little bit about your practice?
Once again, I run Swetech Medical Center. We're a clinic in Clinton Township, Michigan. We like to say we treat people here, not just diseases. We like to be part of people's story and find out more than just their heart, more than just their knee. We like to treat the patients as a whole person, and that includes respecting them as a soul. We like, and I say this, but head to toe, we all factor everything together. We'd like to be a little bit more forward-thinking. We're not tied to corporate hospitals and things like that, so we have a little bit more free reign. We'd like to be a little bit forward-thinking, and my whole team here kind of follows that mentality. And I think our patients do like the different flavor that we offer. If you ever need anything and you're in the area, we'd be happy to take you on, either you or a loved one or friend, coworker, whatever. Once again, that's Swetech Medical Center, and we're in Clinton Township, Michigan.
Well, thank you for joining me today.
Absolutely.
And for answering those questions and helping to educate the general public about interpreters and medical services. And thank you for watching. And please check out our social media, Facebook, TikTok, Instagram, LinkedIn. We'd love to have you join us. So check out them, check out us, and I will see you soon.